convenience store. What? Sorry?
Did you mean in the woods?
Exactly. As it relates to the convenience store, all kidding aside, we haven't thought about it in terms of protecting our revenues. Our revenues have blown up. They've fallen off a cliff. But on a serious note, and I know your question is serious, if you're in a store that's deemed essential, you got to keep distance from each other, and that's the one thing I'd say. And I know that may seem a little paradoxical, and I feel badly about that. But the fact of the matter is, if you're inside an essential retail operation, you got to keep your distance 6 feet. You got to have a face covering, and you got to play ball. As it relates to complete, I guess, Paul, I accept that, by the way. Part of the reason why we've begun to think about this now as a state, I know the federal government is thinking about what does reopening look like. The regional group of states, actually one more than I was when we were here yesterday, Massachusetts has joined, which I think is a very good add. So 7 of us trying to think this through. It includes a heavy dose, and Judy, you correct me if I'm wrong, of healthcare infrastructure questions. So it's not just what's the restaurant look like, but it is what does the testing regime look like? You know, I'm happy we've made a lot of progress, to repeat what I said earlier on testing, but it's not remotely near, we don't have remotely the assets that we need or the technology. And Judy referenced Rutgers. That's something we're going to come back to you on if we think that's got the legs that it looks like it's got right now. But that's a good example. So if you had robust testing that was mass, scalable, you could hear back very quickly, you wouldn't, when I say complete, that masks challenges that you otherwise would have if you literally had to drive this to zero and keep it at zero. And so there's a big healthcare infrastructure element to that. And if you have the confidence that infrastructure, particularly testing, contact tracing, what do you do when you find somebody? How do you quarantine quickly? If we have confidence in that, that allows us a lot faster to get back in the game. Thank you. John, would you be okay with that? Okay. Christina? Okay. The two who need no introduction agree with me. Okay. John.
Can we get specifics on this 2 a.m. visit to the long-term healthcare facility? I mean, where was it? What prompted it? What are the types of things you're finding? And can we get, people are still clamoring for information, families of people in these places are clamoring for information about them. Can we get names of places to see just any kind of information about what's going on there with these types of inspections, where you're going, what you're doing? And the surge, what are the things that you're looking at in terms of, is it numbers of admissions, beds, intensive care beds, to let you know that you're out of the surge? And then, can you detail for us the picture of how you're moving supplies like ventilators and staff around the state, as from hospital to hospital, long-term care, what you're doing? I know on the directive from yesterday about, people have 90 minutes to make a decision about putting somebody on a ventilator, how that ventilator is readily available, as well as staff. How are you keeping track of staff in different places, especially as the surge is in North Jersey and is expected to hit the shore and south later?
Is that it?
Yeah.
Okay. Judy, I think you want to dive in?
Sure. Let's talk about the surge. The 3 models that we have, and we've described this before, as the CHIME model, the IHME model, and what we're calling the Laxmi model, which is a mathematician from New York who's been working with our innovation center. They all use somewhat different inputs, but it has to relate to the rate of infection, the doubling time of infection, the doubling time of hospitalizations, number of patients in ICU, all of those inputs, and I'm sure I'm missing some. The algorithms are different for each one. All of the algorithm then predicts the rate of infection, how many total infections you expect, and then from that it extrapolates into how many hospitalizations. And we're pretty much following what the rest of the nation is seeing, and 80 to 85% of people that are positive end up in the hospital, or home, mild to moderate, 15% in the hospital, and 5% in intensive care. And a percentage of that, you hope, 1% or less, but it's running a little bit more than that. Unfortunately, become a fatality. So the algorithms are a little bit different. We look at all of them, and as I've described, they change every single day. In terms of the movement of supplies, we have a central, we have set up for this a central procurement center. The state police are vigilant, and it's at the Rock, and requests come in, and we look at inventories. We know pretty much what every requester has in terms of their inventory of all of their supplies and equipment. We have made it pretty clear that we've regionalized the state to try to keep the movement, particularly of supplies and equipment, within a region. And if we have to move patients, that they're moved first within the region. We know that there's some very effective systems within the state that already have transport capacity within their own system. And if they can do that quickly with their patients, obviously, we would never say not to do that. It's whatever serves the patient the most and best at a certain point in time. It's happening every day. Every day there are patients being moved. Every day there is equipment and supplies that are being moved. And we know exactly how many ventilators have gone from central procurement to exactly the site where they've been used. We know how many have gone to Hackensack Meridian. We know how many have gone to North Beth Israel, how many have gone to University. We track all of it. And it took us a while to get it up, but it's a while. We had our first case March 4th. It took us a short period of time, I guess I should say, but I think it's working very well.
Judy, I assume the 2 a.m. visit is a privacy matter that you're not going to want to
Yeah, I'm not going to talk about
right?
this particulars, but I can tell you that I get a lot of incoming. I read them all. I respond to all of them. And if I get a complaint or a concern that really sounds something like this couldn't possibly be happening, somebody goes out. And we rely so much on the health officers. They're the unsung heroes here as well. They are taking care of their municipalities, their towns, their regions very well.
We hear on the long-term care, Judy hears it, I hear it, we all hear it, and folks are rightfully looking for more communication and more answers than they're getting, and we've been pounding away on the operators to provide that. It's their responsibility. It's not a New Jersey specific item. That should give no solace to anybody, but this is a huge issue across the country, comparing notes with other states. And I will just say Judy and her team are literally morning, noon, and night pounding away, not just with the health officers going out and seeing it with their own eyes, but just to make sure these operators are communicating what the facts are in each of their organizations. So with that, we're going to fold, if that's okay. Thank you, Judy and Dr. Tan. Eddie, it's great to have you with us. I appreciate that. Colonel, as always, Director Maples. We will be together again at 1 o'clock tomorrow. And I think on Thursday will depend a little bit on the White House schedule. But assume that we'll be here each day for the next several at 1 p.m. And we will continue to get as much information to you as humanly possible. We want to make sure it's the right information. And I would just ask folks, in the meantime, keep doing what you're doing. Keep wearing these masks, or covering your face, as we all do. Keep staying home. I know that's not fun. It's not easy, but it's working. It is absolutely working. We'll have news to report on school year in the next couple of days. That's something we're taking, as you can imagine, very seriously. We're looking to, as we said all along, we make these calls based on the facts, and we'll continue to do that. And again, everybody in the meantime, just keep doing what you're doing. And if you do, and I know you will do, we're going to get through this as one family in New Jersey, stronger than ever before. Thank you all.